Hello anatomy friends, this is Dr. Alsup and we are going to enter into the fun world of forearm muscles. And there are a lot of forearm muscles, almost deceptively so. You have only three kind of major muscles when we're talking about the arm and considerably more when we're talking about the forearm. And that's because some of these tendons are heading all the way to the digits, and those are kind of more fine, precise movements, and we'll talk about those actions in a bit more detail. So we'll focus kind of on the compartments first, so kind of getting the big picture idea, and then talk about some of the specific muscles in a little bit more detail. Okay, so we're going to start with the flexor muscles of the forearm, and we also refer to these muscles as the anterior compartment of the forearm. So remember, when we were discussing the arm muscles, that anterior typically meant flexor, and same thing here for the forearm. Most of these muscles, not all of them, but most of these muscles, particularly the superficial parts of the flexor muscles of the forearm, are going to have a proximal attachment on the medial epicondyle. And recall that medial epicondyle is the projection, that medial projection right around the elbow region that you can actually palpate. And like I said, most of the superficial muscles of the forearm, as well as parts of the deeper muscles, have an attachment here. Some of the deepest muscles and all parts of it may not, but for the most part, we're going to lump them all together with this medial epicondyle, and this will be through what's referred to as the common flexor tendon. So a lot of the tendons from each one of these individual muscles, their tendons will kind of interweave together to form this common flexor tendon. And we'll talk about a few specific distal attachments, but most of these are either going to the wrist region or all the way down to the digits. Most of the muscles in this anterior compartment are going to be innervated by the median nerve, and the median nerve is one of those 5 terminal branches of the brachial plexus. And hopefully that's a theme you're understanding here, is brachial plexus is a pretty big deal in the upper limb. And you'll talk about a bit more detail regarding these plexuses with Dr. Sullivan, but for our purposes, we want to understand which one of these nerves are innervating these regions. So median nerve for the most part, with a few exceptions. So let's start superficial, and then we'll work our way deep in terms of the flexor muscles of the forearm. There are going to be 2 carpi radialis or ulnaris muscles. And the great thing about a lot of these forearm muscles is they tell you either exactly what they're going to do, or where they are, or both. Okay? And so these are great examples of this. So you have flexor for both of these. So flexor indicates what type of action will happen when these muscles contract. Carpi is indicating that this will attach on the carpus region, or some of those carpal bones, and will have a direct relationship in terms of what's flexing. So what's flexing? Well, it's the carpus, or it is the wrist region when these muscles contract. And then lastly, these tell on what side you will find these muscles, either on the radial side, or the more lateral portion, or the ulnar side, or more medial portion. And so you can see right here that for both the flexor carpi radialis and ulnaris, both are going to play a role in terms of flexion of the wrist, just like the name said, right? Now, their other actions are going to have everything to do with where they're located and where they're going to distally attach, and if they contract, if you think about it, the flexor carpi radialis will play more of a role in terms of moving the wrist away from the midline region, or that radial deviation or abduction. And kind of the opposite, the flexor carpi ulnaris will adduct the wrist, or ulnar deviation. And these will kind of match up with their extensor partners on the back to really have a forceful contraction. Flexor carpi radialis will be innervated by the median nerve, like most of the muscles in this region, but here is an exception to the rule. The flexor carpi ulnaris muscle will be innervated by the ulnar nerve, which is, I think, the last of the brachial plexus terminal branches that I've yet to mention. So ulnar nerve will play a big role in terms of innervating muscles of the hand, but it will also send a few branches off to some of the more proximal muscles, such as the flexor carpi ulnaris. So a nice exception to the rule, and we always love a good exception. Now looking at these images here, this is a straight anterior view. And you can see that a lot of the muscles associated with this flexor compartment are kind of more off to the more medial side of the forearm. You're going to have this large muscle here that we'll talk about in more detail, Brachioradialis, on the more lateral side, kind of taking up a good amount of the anterior part of the forearm. Now this is not going to be an official part of the flexor compartment, Brachioradialis. So flexor carpi radialis will be the one that's kind of located right here. It's next to the pronator teres, which we'll talk about in more detail in a moment. And if you're looking at the flexor carpi ulnaris at this straight anterior view, so this is that same view as we can see right here, you can see that you don't see a good amount of the flexor carpi ulnaris. In fact, it's a little bit easier to see on the extensor or posterior side, which is what we're looking at here. So a good amount of that bulk you can see a little bit more on the posterior side, but it is certainly going to play more of a role in terms of flexion, so that is why it is considered part of this particular compartment. Okay, moving away from some of the superficial muscles into the intermediate layer. So there'll be a superficial, an intermediate, and a deep layer associated with the flexor muscles of the forearm. And the intermediate layer is only composed of one muscle, but it's a big one, flexor digitorum superficialis. So same thing here. Let's kind of break down this name. Flexor, so it's telling you what type of action will occur with contraction here. Flexion of digitorum, meaning digit, so we're flexing the digits. And it is superficial, because we will have a deeper version of this muscle, or they'll be pretty similar in terms of where it is heading. So flexor digitorum, its distal attachments will be on the middle phalanges of 2 through 5. So this is 1 of 2, 3, 4, and 5. Make that 2 look a little nicer. And so it will have its distal attachment on these middle phalanges. We'll see that deeper flexor digitorum profundus will extend all the way to the distal phalanges, but in the case of the superficialis, only to the middle phalanges. So this muscle, it does cross the wrist joint, so it can play a role in terms of flexion of the radiocarpal joint, but really its main actions are associated with flexing the metacarpophalangeal joints, or the MP joints, and the PIP joints. It would not flex the DIP joints because it doesn't extend all the way to the distal phalanges. So you can see that here. You can also see that these tendons are going to be traversing the carpal tunnel. Here is that matching muscle that is a little bit deeper, the flexor digitorum profundus. So flexing the digits. Profundus means it's quite large. It's also going to be the deepest, or in that deepest layer. And this is the muscle that will have its tendons extending all the way to the distal phalanges, so all the way on these distalmost phalanges. So it can flex the wrist, which I don't have here because really the main actions are flexing MP, PIP, as well as DIP. So it's really only the flexor digitorum profundus that will flex the DIPs. Now this is going to be innervated by the median nerve for a good amount of it, but it also will have some innervation or some muscular branches from the ulnar nerve as well, more so on the ulnar or the medial side of the muscle. So this would be more median, and this would be more ulnar innervation. Okay, let's talk a little bit about that muscle that is kind of an oddball. And this is going to be the brachioradialis. So again, this is an anterior view. We have palmar, I like to say anterior. And so you can see over here is what we consider part of the flexor compartment of the forearm. And then you have this large brachioradialis over here that is taking up a good amount of the anterior portion, but not considered part of the flexor or anterior compartment of the forearm. It is unique in the fact that it is going to cross over the elbow joint, and it will not extend to the wrist joint. So it's really, its main actions are going to be associated with the elbow, to weak flexion of the elbow. So it would be flexing the forearm as well. It's really kind of plays a role in terms of that intermediate position. If you think about pronation and supination, it will kind of play a role in terms of that in-between action. If you think you kind of put your hands down to your side, you're not fully pronating, you're not fully supinating, you're kind of in the middle. And brachioradialis will play a role in terms of that kind of sustained motion there. Now, this is going to be innervated by the radial nerve. So this seems a little bit like an exception to the rule because the brachioradialis is more easily seen on the anterior side and it is a flexor. But it will be innervated by the radial nerve, and so we want to keep that in mind because that is an exception. So it's a flexor innervated by a radial nerve, which is an oddity. We also have some pronator muscles associated with the anterior compartment of the forearm. So sometimes you'll hear flexor compartment or pronator compartment, flexor/pronator, because you do have the pronating muscles associated with the anterior side of the forearm. And so there's two major ones. There is the pronator teres, and you will also have the pronator quadratus that looks like this little band-aid on the distal portion, kind of right above the wrist region. And these, as I mentioned, are located on the anterior forearm, so kind of part of the flexor pronator compartment. And this is a pronator muscle, meaning that it's going to play a role in terms of either moving the proximal radial ulnar joint or the distal radial ulnar joint. But if you think about muscle attachments and the distal attachment, or the kind of the more movable attachment, where would these insert? Recall, what is the movable bone when you're talking about pronation and supination? It is the radius. So both of these muscles, since they're playing a role in either pronation or supination, and in this case, of course, we're talking pronation, it is going to attach on, or have its distal attachment or its insertion on the radius. Okay, on the other side, or on the posterior side, you will have the extensor muscles of the forearm, or aka the posterior compartment. And before I move too far, hopefully this is something you remember from the last video. When I say a posterior compartment, what do you think the innervation should be? It is the radial nerve, and that is certainly the case for the extensor muscles of the forearm, in addition to that brachioradialis, which you can see if you're looking at this posterior view. So we have dorsal view. As again, I like to use the term posterior. You can see some of brachioradialis as well. So that's how large that muscle is. So you can see it a little bit on the extensor side or posterior side as well. Most of these more superficial muscles are going to have a common attachment on the lateral epicondyle, similar to what we had with the medial epicondyle. And it will, many of these tendons will kind of interlace to form this common extensor tendon. Most of the muscles in this region are either going to play a role in terms of extension of the wrist, or the wrist and the digits. as well as abduction and adduction of the wrist. So similar to what we had with the flexor carpi radialis and flexor carpi ulnaris, you have kind of matching ones on the back, on the posterior side. So you have the extensor carpi, so we'll extend the wrist on the radial side, and on this posterior side you have both a longus and a brevis, and they're both important. In terms of the practical component, I'm only going to have you be able to ID the longus, but you can see both of them over here. So here is the extensor carpi radialis longus belly and the brevis, so they're kind of right next to each other. You will and so this muscle, similar to what we had with the flexor carpi radialis, will abduct the wrist or radially deviate the wrist, whereas the extensor carpi ulnaris, which is fairly dominant here, will adduct the wrist or ulnar, or deviate in terms of an ulnar direction. You also have an extensor digitorum, similar to what you had on the anterior side, but you just have the one, so you only have one extensor digitorum, and these will extend to the digits as part of these extensor expansions that you can see. That'll play a role in terms of extension of the digits, or the joints of the digits. Okay, so those are forearm muscles in a nutshell. Be very aware that I did not cover many of the muscles of the forearm. There are numerous ones. I didn't even get into the deep layer of the extensors. So we kind of went big picture in terms of these muscles, and there's a continued world of things to explore there if you ever get into more of a musculoskeletal discipline. So know that we're kind of talking big picture in what we discussed here today. All right, so a review question. Damage to the median nerve near the humerus would most likely affect the actions of which of the following muscles? A. Brachioradialis. B. Extensor carpi radialis longus. C. Extensor digitorum. D. Flexor carpi ulnaris. Or E. Flexor digitorum superficialis. Okay, so pause the video. I want you to think about it yourself for a moment. And when you're ready, let's first go through the stem to kind of find those key things. Okay, so you know that there is damage to the median nerve. So right off the bat, I'm starting to think, okay, what's going to be innervated by the median nerve? Now, you also have here near the humerus. And the reason that I put this in the question stem is say if you had some type of damage to the median nerve in the carpal tunnel, do you think that would affect these muscles of the forearm as much? No. Typically, it will only affect those muscles or the sensory component of the skin that's downstream to the injury. So, if the injury happens near the humerus, then it could affect the muscles of the forearm. Okay, so median nerve again, and it's affecting the actions of which of these muscles? So think about it before we even look at the answer choices. Median nerve is going to innervate what out of what we just discussed? So it is most of the muscles of the anterior compartment of the forearm. So let's look at this real quick. Let's kind of get rid of the ones that aren't part of that compartment. Brachioradialis you can see on the anterior portion of the forearm, but it's not part of the anterior compartment, and it is that kind of oddity in the fact that it is innervated by the radial nerve, so no. Both extensors, if you think extending, think posterior compartment, so these are both out as well. So that leaves us with these two flexor muscles. Flexor muscles we know are part of that anterior compartment. So one of these, though, is going to be innervated by the ulnar nerve. So it's one of those exceptions to the rules. And you can see kind of from its name, it has, ulnar right in there. So that is kind of telling that this is going to be innervated by the ulnar nerve. So both the flexor carpi ulnaris and about half of the flexor digitorum profundus will have an innervation from the ulnar nerve, but everything else in the anterior compartment, including the flexor digitorum superficialis, will be the median nerve. Yay! So anterior compartment with a few exceptions, as we just discussed. All right. Excellent work here. As you kind of work through these concepts and you have any areas that you'd like to kind of talk through or think about it in a different way, please feel free to reach out to me with any questions. Thanks for your time and attention, and we will finish off the upper limb in our next video, which are the muscles of the hand. Thanks for your time. Bye.